Hey, today in Marketplace Health, we're talking about the importance of hormone replacement. And with us today to discuss this, Yvette Pagan and Dr. Vern Reynolds from Restorative Health. Good to have you both back.
Good to be here.
You know, it's one of those things up until a few years ago nobody really talked about. You just kind of quietly suffered through it. But now through these methods and others, people are finally finding relief. So who needs this and what are the symptoms of having some kind of a deficiency?
Well, there are several people that would need it. Everybody ages. We're all going through that process. So anybody that feels fatigued, tired, hot flashes is definitely a symptom. Lack of libido. The things we start to see as we peak into the 30s, 40s, those kind of things.
And it's so unfair because those should be the time when things get easier for you, but they don't. And you mentioned that, you know, this is not just women specific. Men too have problems,
Absolutely.
don't they? And tell us about some of those symptoms.
I'd say the biggest thing we see with men is decreased sex drive, joint pain, and they just accept this is a part of my aging process. I'm 40 or 45, 50, and that's not the case. We can definitely make a difference quite quickly.
So explain to people what restorative health could do for them. If you needed a hormone replacement therapy procedure, what exactly is that procedure and how does that work?
The very basic first step that people should take if they're having those symptoms, come in. It's a free consultation. We do blood work, and we can determine the areas where you need help. And we can customize a therapy that will benefit those areas that you're not feeling that you're at peak.
So when you're looking at the blood and it's being determined, you're seeing deficiencies in vitamins, deficiencies in on hormone levels, obviously, but what exactly are you looking at?
We look at, like I said, a female has more hormones, estrogen, progesterone, and testosterone, as opposed to the male has primarily testosterone, but we do look at a complete balance of those. And it's not just the numbers. We take into consideration the patient's complaints or their deficits. We have a great little chart we have them fill out, which almost targets for them as well. If they say, you know, I'm having trouble sleeping, you can almost track to see what hormone is responsible for that versus their irritability or their anxiety or their fatigue. And it almost always correlates, so they agree. So as we sit and talk with them and tailor it to them, we target their dose and treat them accordingly.
So explain the difference, because we've heard about synthetic hormone replacement and then there's natural as well. How do those two differ?
Well, the natural hormones are those that we can extract from plant sources.
Okay.
Soy or yams, we use yams, and those have naturally occurring hormones in them. Synthetics are any pharmaceutical hormone, which they've been linked to other side effects.
So we're going all natural here.
Completely natural.
Okay, good to know.
Yes.
And then if someone is hoping that they can make a change in their hormonal plateau or wherever they're at right now, how quickly can you really expect to see your life improve?
We see people literally in 3 to 5 days, and they come back and it's more astonishing than you would even imagine. You know, they expect it to be good, but they come back with a wow factor. Like I said, a lot of times they'll come in with their spouse who not there for themselves, but when they hear their wife, they're on board as well. I mean, it truly makes a difference.
And then there's a maintenance period, right? So you get them up to those levels, and then how often do you see them when they maintain?
On average, a patient will come in 4 or 5 times a year, so about every 3 months.
That's incredible. So if you're out there and you're feeling the chin hairs, come on here right now. We were joking about this earlier, but it isn't something to joke about. I mean, hormones, for real. I mean, there is that period in time where you have a deficit, and so it's good to know you can buoy it back up with some intervention here.
Absolutely.
And they should contact you, I'm sure, for a consultation.
Yes.
Thank you both for being here.
Thank you.
Appreciate it very much.